Well, well, today at PowerTime, and thanks to you guys for your patience and it's been my pleasure. All new and some old things that are going on in our lives at PowerTime. So, welcome again to Power Time. It is just shy of 4 p.m. So, one more moment and we'll get it going at Power Time. Hope you all have had a pleasant transition to spring. I cannot wait for some more good weather. So, we will wait patiently because we have no choice because we're not in charge of that. So, at Power Time today, we are going to just have a quick little chat and some thoughtful discussion, things that might help you in the future or have helped you in the past. There we go. So you are so wonderful. You. I love you. And I will always say that each and every time we meet. So, welcome again to Power Time. I'm Sharon Herbert, the Power RN, and I have been a registered nurse in many sectors for a very, very long time. My love and my first love has been neonatal intensive care. But as I took my turns in different other sectors, it has been my pleasure to meet new, and I will call them family members that have grown. We've shared and cared and helped each other along the way. And that is a lifelong journey for me. So here we are today, Power Time. Our topic is just going to be a little talk about some of the personality traits. So powerful and so wonderful and such cherished members of the healthcare system. And no one can ever change that. Nurses will always be the most cherished members of the healthcare system. We got it and we'll keep that if indeed we don't take it over. We'll never go backwards. So, welcome again to Power Time, coming straight to you, the Power RN from Power in Nursing. And you can find that website, powerinnursing.com, and hook up with me there. But today, what are your thoughts? What are your thoughts about some great personality traits that nurses possess? And in order to make the system work very well, we have to be in those certain places and spaces. And if you've thought about it, or if you're coming aboard just thinking about being a nurse, take it from me. It is a marvelous setting and career profession. And like I say, the healthcare system can't live without us. But there are some things that we can do to make our lives as nurses become better, become better and more and easier, I guess, for us to get along. So think about what ways you can work that can make you work better within any system. To be a nurse, of course, you have to complete your education, and that takes several years, and you'll get some of this along the way. But for sure, when you get to your new job, after you passed your NCLEX and you're so happy to be a new RN, you'll find that some of these traits will really come in handy. So, we'll talk about 5 great personality traits, and you'll find that they can help you in other settings as well. So, we know that in our day at work, in the workplace, you'll see things that you expect and you'll see things that you don't expect. And we had a very bumpy last year, and there are a lot of changes that we didn't expect. But for nurses, we must remain calm, whether it is a raging storm or just a surprise. We have to remain calm so that we can help the system, help the patients, and the situation so that everyone can come out to the best that we're able to help them, whether it's a patient who has taken a turn for the worse or a raging storm that, causes the power to go out or something like that. We have to be able to fix it or at least acknowledge it. So that's calmness. We talk about calmness. We've got to be calm. Whether your patient is coding, and I can remember for myself that the role that I take has been making sure everyone is okay. Everyone is okay when things are going wrong. So it's important that someone makes sure the lights are on when there's a crowd that's jumping into progress in saving the patient. So we have enough light and we have everyone in their stations. So calmness, confidence, and especially when you're working with a team, but for yourself as well, you've got to know what you're doing. And that will be certainly a pleasure for the physicians and the team members that you're working with. I can't tell you what you might experience if you don't know what you're doing, but I can tell you how your team will love and cherish you when you jump in and you know what you're doing and you do the right thing. The patients will love you too, all the time, when you're doing the right thing. Now, about, what about being patient? Not as in having a patient, but patience. Patience in getting yourself situated to make sure that things that you are planning go in order, but even the things that you aren't planning, that you're able to make an assessment and pull through, even if it is a patient with a T, patient that is anxious or their family is anxious. You need to make sure that things are going at least in order. Maybe your patient family doesn't understand what it is that the doctor just said to them, but they weren't comfortable enough to ask the doctor a question. And that doctor walks out of the room, and then they ask you, well, I don't know what he said or what she said. Can you tell me what it is? And you can't fly off the handle and say, well, the doctor just talked to you. You have to be patient. Put yourself in that person's shoes. And if you weren't a healthcare provider, you might not know what stage 4 colorectal cancer is either. And they want your help and they're scared. So be patient. Be patient. Be patient. You've got to be the one that keeps it together for the system and for the patient and family. What about number 4? Leadership. You've got to keep the situation at hand. And there may be times, maybe you are the preceptor today, or maybe you're the charge nurse for today, and there's a weather event and or a physical event where there's a shooting. You've got to be able to understand what it is that's needed to get you through this treacherous, torturous emergency time. You've got to keep it together and know what needs to be done. Again, you'll be glad for yourself. And even in the worst event, you are